let's talk about filler, because you mentioned earlier filler goes away. Obviously, we're hearing now like filler can actually last for a very long time. How do people go about getting tasteful filler? Like, what is your approach when it comes to that? Because you just mentioned you have filler in your cheeks, but you don't have that typical look.
Overdone. And I have a lot. I mean, I'll be 40 this year in a few months. I started when I was 30 and I've always had a long, narrow face, but not really like full cheeks. And I like to be skinny, but when I'm skinny, my face, the fat in my face depletes.
Yes.
So I want a little bit of volume in my face. I gain a few pounds, my face looks good, but I don't like my body.
That's my exact thing. And I got fat in my face and I was like, I would rather like feed the fat and have that extra 5 pounds and have my face be plump than be skinnier.
But with that being said, you don't want to overfill. Back when I started in this industry, I was not an injector. I was assisting a surgeon who injected full time. And I realized I could be an injector simply by watching what he's doing. I realized I had the eye for it. And it's not just about being able to hold the needle or just deciding I'm going to be an aesthetic. You really have to have the eye, and you learn that really everyone doesn't. You can be very knowledgeable, know the anatomy so well, but if you don't have the eye, you're still not you're going to know where that artery is. And you're maybe not be able, you're not going to cause an occlusion or do anything wrong.
Yeah.
But it still might not be put in the right place. So when you have the eye for it, you make sure you I don't know how I'll say, you make sure you don't over inject, and fillers can stay for years. I know that they've looked at ultrasound fillers from 14 years ago and it's still there.
Wow.
I've done my cheeks multiple times over the past 10 years. I haven't touched them for a year and a half, but if I don't touch them for an even longer time, they will be there because they're layered many times in close increments. I have patients that'll come to me and want more lips, and I'll be like, well, your lips are already too big with the proportions of your face. And they'll say, oh God, I haven't done them in 2-3 years. Okay, well, how many times have you done them in the past few years? Oh, 7, 8. Okay. Have you used Juvederm Ultra Plus? Yes. Well, there's still filler in there. I'll be like, no. I'm like, yeah, I can look at it and see there's filler there. And then we'll dissolve it because it's migrated or whatnot and maybe start from scratch. But I just think that overfilling is like the worst thing that you can do. So again, going back to less is more. No matter what area you're injecting, whether it's tear trough or, mid face, you don't want to look like filler face, like a pillow face.
How do you keep it from migrating in your cheeks?
Not every area migrates. Some of the most common areas that migrate are lips. You're constantly moving them, The eyes can tindle and migrate. My cheeks have never migrated. They're down on bone, Voluma, Juvederm Voluma. It's a thicker filler. It's never migrated. My tear troughs, I didn't think they migrated. Recently, I went to Dr. Arthur Swift in Miami. We have a cadaver dissection in Miami I went to. And like my under eyes have been done 7-8 years ago. My second daughter is 7.5. Gia is almost 8. I did it after she was born. And I'm like, well, I told him, I said, I think my under eyes look great. And he goes, well, I could see a little bit of sausage filler.
Wow.
Tyndall effect that's come out. And back then, Juvederm was used under the eyes.
Right,
and every year
thicker.
It's a little thicker. I mean, I still think they look great, and I'm not going to dissolve them. And, sometimes you're chasing the rabbit's tail. Some areas if it's not broke, don't fix it. You're going to dissolve, then you're going to refill, and then you're going to dissolve. You're never going to be happy.
Yeah.
And I've learned myself, I'm in the field, right? So I do this all day. It's very easy to get like kind of, oh God, should I do a little bit? It's been so difficult. I mean, I'm happy with my lip size. I've always had thick lips, but sometimes you look and you're like, oh, I'm almost 40. They've depleted. Should I do it a little? It's very easy to fall into that. And I've learned, and a lot of it is seeing other patients and how they're not happy with the aging process. I've learned to really accept some things. Not everything can be fixed, and you shouldn't hold a mirror this close and say this little line bothers me. Some things we have to be happy about, and if you can minimize it and age gracefully, and it's all very subjective, but I think that it's more healthy to just be okay with a lot of the things, because it's never going to be perfect. Some lines occur upon movement, when, what dynamic, and you don't ever inject based on movement.
Yeah.
If I tell patients all the time, I could do your smile line, but the minute you talk or smile, it's going to indent again.
Right.
So I just think that keeping it more on the subtle, natural side is always better.
Mm-hmm.